Suspect rupture in female patients with sudden onset abdominal pain, rupture of an ectopic pregnancy, or an ovarian cyst. While transabdominal ultrasound may not be of much value to the untrained operator, visualization of free pelvic fluid or very large cysts can help narrow down the cause of the patient's complaint. Serum lipase levels may be normal or even low in patients with chronic pancreatitis or necrotizing pancreatitis. Diabetic patients may occasionally administer their own insulin during their stay in your ED and not tell you. Myocarditis can sometimes lead to heart failure in young patients. Use bedside echo and request labs as appropriate. Before making a diagnosis of sialolithiasis, make sure you have excluded Ludwig's angina, which is an infection of the floor of the mouth and neck. Both require antibiotics, but the latter requires admission and aggressive treatment. A full-body CT may sometimes be justified in the workup of the acutely unwell patient, where there is no obvious explanation for the patient's condition. Examine the lower limbs of any hypoxic patient and look for signs of right heart strain on the ECG. About 25% of cecal adenocarcinomas present like acute appendicitis. Likewise, gallbladder carcinoma often manifests with right upper quadrant abdominal pain, simulating conditions like cholecystitis. Be mindful of patient allergies when prescribing on paper. Patients with aortic dissection sometimes give a history of chest pain preceded by straining. Illicit drug use, poorly controlled hypertension, or discontinuing antihypertensive medications have also been linked with aortic dissection.